Good morning, it's Marco Scarci, consultant thoracic surgeon from London. Today we're going to talk about the investigation that are needed for lung cancer. Most of my patients comes to me with some form of investigation, and sometimes they are surprised when we ask for more tests before their surgery. So what are the most common one? So something that all patients get is a CT scan, and this is a staging CT scan with contrast. You can think of a CT scan like a black and white photograph. The next test all patients have is a PET scan. You can think of that like a color photograph where you are injected with a radioactive or mildly radioactive sugary dye that is captured more by cells that are quickly replicating. Then you have a lung function test. This allows us to check how much of the lung we can take out and whether you are likely to be short of breath after surgery or not. Then we need to perform some tests to make a diagnosis of lung cancer, and that could be either a CT guided biopsy where we put a needle into the nodule through a CT scan guidance, or we can do a bronchoscopy. We can also do a kind of a special bronchoscopy which is called EBUS that will allow us to sample the lymph gland that are along the windpipe so that we will be able to have a tissue diagnosis to understand the type of the cancer you got and also stage it at the same times. These are the most common tests that we do. Then there can be other tests that are specifically designed for each individual patient to check other situations such as their heart condition or the condition of other organ. But the main one I've just mentioned. So if you've been diagnosed with lung cancer and you have any doubt, please get in touch for an opinion or even a second opinion. If you're not convinced, I will be more than happy to talk to you.